Hello, everyone. I'm Dr. Noelle Bissell, Director of the New River Health District, and I'm going to give you a brief update on the COVID-19 situation in our area, which includes the counties of Giles, Pulaski, Montgomery, and Floyd, as well as the city of Radford. Many of you have written us with your questions about COVID-19 and your concerns. This pandemic is affecting so many people in different ways, and your questions help us to understand your concerns. If you have a question, it's likely that other people are wondering the same thing. So thank you for reaching out to us. We're here to share our understanding of the pandemic with you. Our answers to your questions will be posted on the NRV Road to Wellness webpage where you submitted the questions. Let's move to the status of the pandemic in the New River Valley. We have had community transmission throughout our region since this summer. When the students returned to town, increasing our population by over 50,000, we had an expected spike in cases in Radford and Montgomery County. That spike has since gone down. You can see from these slides with the combined incidence of cases in Montgomery and Radford that we did have an increase which has since come down. And then we divide them into the individual locality. So you can see that these spikes occurred approximately 2 weeks after the students returned to the area as we expected and have come down very nicely. The good news is that the students who were infected with COVID did not spread this within our general population. We know the virus did not move from the students into the rest of the community because you can see from the data that we found the cases were concentrated in the 18 to 24-year-old demographic, which is our college students. This next graph shows that very clearly in color, the rise in that age population, whereas our community population, which is all of the other age demographics, remained fairly steady. I will say that that slight increase in the red at the bottom of those pages, of those bars, is actually some community spread and is not related to the students. The evidence collected from our contact tracing and case investigations backs up these numbers. We investigate every positive case in our region. Every interview is a risk assessment. With the students, we ask about where they live, with whom, where they go, what they do, if they have local jobs, church attendance, what their contact with local community members might be, and any interactions they may have with mental health, the hospitals, or law enforcement. The number of people in the rest of the community testing positive for COVID-19 has stayed relatively stable with some low-level community transmission, which we would expect, and hospitalizations had not been impacted. Many people in our community were concerned because a model had shown the possibility of a different outcome. The University of Virginia model did show a significant increase in cases. This model cannot account for differing levels of susceptibility to infection, however. Those who physically distance and avoid large social gatherings, wear their masks, and are careful about hand washing and not touching their face are less susceptible than those who do not adhere to those practices. Our cases about 2 weeks ago were actually 550 for the week. Last week, they were about 330 for the week. And this week coming up to an end on Sunday, we are at about 220 cases. Our community has successfully dealt with these spikes, and thanks to everyone for following safety precautions by watching our distance, wearing our masks, and washing our hands, and not touching our face, we have seen the decrease that we had expected. Currently, we have no indicators that would prevent Montgomery County schools from moving back to in-person instruction, and students will be back in their classrooms beginning on Monday, September 28th. We really appreciate the effort and patience of all of our teachers, students, parents, and administrators working together through this very challenging situation. A major concern for us now is the approach of flu season. COVID-19 and the flu have many similar symptoms, which will make it more challenging to test, identify, and isolate the COVID-19 cases. People with serious cases of the flu will need treatment and space in our hospitals. We want to minimize the flu outbreak, and we ask that everyone get vaccinated for the flu. It is a serious illness that can be dangerous for some people. We want everyone in the community vaccinated this month of October. By getting the vaccine, you protect yourself, but also others who might have health conditions that can make the flu more dangerous. And having a concurrent infection with flu and COVID could be very dangerous for some people. You can get your flu vaccine at local pharmacies or your physician's office. The health department will offer another community vaccination clinic on Wednesday, October 14th at the Blacksburg High School from 9 a.m. to 2 p.m. We are also working with our local schools to offer flu vaccination to students again this year, as well as staff. We thank you for all of your help and patience as we deal with these health concerns. The best way is to stay informed, watch your distance, wear a mask, wash your hands, and don't touch your face. Together, we can all navigate this pandemic together. Thank you, and I look forward to more questions and answers in the future.